My name is Dr. Mad. Very nice to meet you. How are you doing today? Okay, so you're not feeling that well. Well, I would love to take care of you and I'll definitely do a medical exam. But first, let's go ahead and verify your first and last name. I want to make sure that if you're a new patient, I have you in my system, or if you're a returning patient, that I have the right chart. Does that sound okay? Okay. Can I please have your first and last name? Great. And your date of birth? Okay. Can I please have your social security number? And lastly, do you have any allergies? Okay, not that you know of. Good. So I can see that you are definitely a returning customer, and I appreciate that. Thank you so much for coming back. Now, what brings you in? What kind of symptoms do you have? Okay. Oh, wow. I'm so sorry to hear that. Yeah, I can definitely do a cranial nerve exam. It's going to be really quick because I don't have a lot of time. I gotta run to the other clinic that I have on the other side of the city, but hopefully there's nothing very wrong with you, and by the end of this exam, we're going to have positive results. Okay, so tell me a little bit more. Are you experiencing any double vision, any blurry vision? Okay. Do you have any headaches right now? On a scale of 0 to 10, how bad would you rate your pain? Okay, great. Are you feeling any tingling sensations in your limbs, your hands, and your toes? Okay, no. Do you feel any sharp pain on your spine, in the back? You don't, good. And you're saying that you hit your head? Okay. Can you please show me exactly where you hit your head? Right there? Okay. In that case, we're definitely going to have to do a very thorough cranial nerve exam. I want to make sure that I don't miss any symptoms, and I want to make sure that you go home healthy. Does that sound okay? Okay. So, first, I would like to just wash my hands. And it's very important to put on gloves even though we wash our hands. It's like saying I'm double protecting you because my hands are washed. The gloves, while I'm putting them on, are also washed, like they're sterile because we take them out of a box. And now I would like to take your oral temperature, so I'm going to put this inside your mouth. Is that okay? Okay, great. So please, do you mind if I come a little bit closer? No? Okay. So I'm just going to ask you to open your mouth, and we're going to put this in. Okay? Good. Just hold it in just like that. Okay, great. And just for 10 seconds. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Wonderful. So you don't have a fever. Your temperature is 97.9, which is absolutely normal. Now I would like to check your pulse. I usually like to take the one on the wrist. So is it okay if I put my fingers on your wrist? Okay. So I'm going to check both. Okay. I'm just going to feel your pulse for about 30 seconds. Is that okay? Okay, good. So 30, 29, 28, 27, 25, 24, 23, 22, 21, 20, 19, 18, 17, 16, 15, 14, 13, 12, 11, 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Wonderful. So your heart rate is about 70 beats per minute, and it's pretty regular, and also it's synchronized, and so that's very reassuring. Okay, now I would like to measure your breaths. So I'm not going to count backwards now. I'm going to count from 1 to 30, and those will be the respirations. Okay, so I'm going to need you to not focus on your breathing, just focus on what you see. Let's say you see behind me there's this big green leaf, just focus on that, okay? So just breathe normal. Just breathe normal. Try not to take deep breaths in and just breathe normal. Don't focus on your breathing, that's very important. And I'm counting your respirations right now. Okay, very good. Good. Wonderful. Okay, so just keep on focusing on the leaf behind me and try not to focus on the sounds that you hear around us. We have a very busy clinic. Okay, wonderful. So your breaths are also 12 per minute, which is absolutely normal. Now I'm going to take your blood pressure. Do you have any arm preference? I know sometimes people prefer the left arm because it's very close to the heart, but to be honest, in the medical field, it doesn't really matter as long as your feet are both aligned on the ground, you're not talking, and you're relaxed, and it doesn't matter which arm I use. So as long as you're comfortable with any of them. Sure, we can do it on the left arm. That's perfectly fine. Okay. So let me just put this right here. Okay. Perfect. Just hold it like that. Good. And I'm gonna ask you if you can please hold the monitor. Okay. Perfect. Sure that this is right, and I'm going to use my stethoscope. Okay, so just relax, breathe normal, and make sure that both feet are on the ground. Okay, let's begin. Very good. Okay, so let's just hold this out. Okay, so your blood pressure is a little bit elevated. I'm not sure if it's regarding to the head because you hit your head yesterday, or if your blood pressure is sometimes on the high end. And you are not aware of that. But let's go ahead and continue with the medical exam, with the cranial nerve exam, and I'm gonna see exactly what's going on. Okay, I would like to listen to your heart if that's okay with you. Okay, so I'm just gonna put this right here on your chest. Take a deep breath in. Okay, now relax. So I'm just gonna listen to your heart first. You don't have to do anything. You can breathe normal. Okay, good, 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 good. And now we're going to listen with the bell. We're looking for any murmurs. Okay, so I'm not noticing any murmurs. So now we're going to listen with the diaphragm. Take a deep breath in and relax. Okay, one more time. Take a deep breath in and relax. Okay, so your breath sounds are also normal. Now I would like to check your reflexes. First, we're going to check reflexes on your face. So let me tap here. Perfect. Let me tap here. Okay, good. Here. Okay, good. Tap here. Okay, perfect. And on the forehead. Okay. Okay. Wonderful. Everything seems to be normal so far. Okay. Now we're gonna go ahead and we're going to check your eyes. So just look straight at me. Okay, good. Look straight at me. Okay, very good. Now look this way. Okay, good. Now look this way. Okay. Now look at my fingers right here. Look at the light. Okay. Look at my fingers right here. Look at the light. Okay, good. Now just follow the light with your eyes only. Don't move your head. Okay, tell me when you don't see the light in your field of vision anymore. Good, good, excellent, good, good, excellent. Okay, look at the light. Can you please tell me what shape I'm drawing? Very good, excellent. Look at my fingers right here. Okay, now look at the light. Okay, I know the light is very bright, so just try to focus on, keep your eyes open. Okay, look at my fingers right here. Good, now look at the light. Okay, now look at my fingers right here and look at the light. Okay, great. Look at my fingers, look at the light. Okay, now I'm gonna need you to look at my fingers, both of them. You see them? Okay, great. Now please tell me which fingers are moving, right or left. Good, 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 good. Look at my fingers. Good. Now please tell me when you don't see my fingers in your field of vision. Good, 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 perfect. Okay, now look at my fingers. Tell me when you don't see them in your field of vision. Good, 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 good. Same thing, look at my fingers. Okay, tell me when you don't see them in your field of vision. Good, 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 excellent. Okay, now we're going to create some pressure in your eyes. I need you to pinch your nose and hold your breath. Can you do that for me? Okay, so just focus right here on my fingers in the back, and I'm going to take a look inside. Okay, very good. Just focus on my fingers. Excellent. So your ocular nerve is intact on the right side. Now I'm going to go ahead and check your left side. So just focus on my fingers right here. Okay, good. Focus on my fingers. Perfect. Okay, wonderful. Everything is intact. Now I'm gonna need you to tell me exactly what color you see right here. Don't focus on the one that I just showed you. Okay, so yeah, this is green. And can you please tell me what color this is? This is pink as well. Follow the pink color with your eyes only. Don't move your head, okay? Okay, good. Okay, you're doing great. Wonderful. Now we're gonna go ahead and check your nose. So I'm gonna need you to look up. First, we're going to look for any kind of obstruction. Okay. Good. Nothing in there. No deviated septum. Excellent. Excellent. Your nose is not obstructed. Everything is wonderful. Now we're gonna go ahead and check your ears. Okay. So I'm gonna need you to look this way. Okay. So we're going to first look at the tympanic membrane. Tympanic membrane is intact. There's no intracranial fluid leaking, which is good. And I'm gonna do the same thing on the other side. So just look that way for me, please. So the same thing, I'm looking for intracranial fluid leakage, and I'm not noticing anything abnormal. Okay, great. Okay, now we're going to check your hearing. So I'm going to create a vibration sound, and I'm going to put it right here on your mastoid process. Please tell me when you don't hear the sound anymore. Now, good. And we're going to do the same thing on the other side. Now, okay, very good. So everything seems to be intact. Let's go ahead and check your smell. So can you please tell me what this smells like? Lavender. Okay, very good. I have one more. Can you please tell me what this smells like? Citrusy. Okay, very good. And one more. Can you please tell me what this smells like? Coconut. Very good. Next, we're going to go ahead and check your facial sensation. So can you please tell me if you feel this? Okay, very good. And do you feel this? Very good. Did you feel it equally on both sides? Okay, let's go ahead and try this one more time. Did you feel that? You did. Okay, what about here? Did you feel it on your forehead? You did. Okay. Did you feel it equally on both sides? You did. Now, let's go ahead one more time. I want to make sure that I have everything. Did you feel that? You did. Okay. So, wonderful. And the last thing that I'm going to check is your taste. Are you ready for that? Okay. So, I have here a few taste solutions, and I'm going to just spray a Q-tip with one of them. And please open your mouth. Good. Can you please tell me what that tastes like? Watermelon? Very good. And now I'm just going to drink it, and let's see, I'm gonna try one more. Can you please tell me what that tastes like? It tastes like coffee? Okay, very good. Let's go ahead and try one more. I think this one will be very, very tingly. So let's go ahead and give it a try. Okay. Can you please tell me if you taste this? Okay, what does it taste like? It tastes like coconut. Okay, wonderful. So you passed your cranial nerve exam. I will prescribe some medication that will help you heal faster. Does that sound okay? And I think there's nothing wrong with your cranial nerves. All right, wonderful. So I'll see you at the reception. I'm going to give you your prescription there. Otherwise, you can, leave a comment or like the video if you did like the video. Otherwise, I'll see you soon. Bye.